So my name is Mark Olschesky, and I serve as the Chief Data Officer at Catalyze. And Catalyze is a company. Our goal is to provide the cloud computing layer for healthcare. We do that through multiple means, hardware, hosting, software, but really trying to be the thread that ties together healthcare applications between vendors and hospitals, payers, et cetera. And we really try to be experts in security, compliance, networking, and especially in relation to digital health. So recently we became sponsors of mHealth as an organization, not just backing them as a sponsor financially, but also entering into a partnership where we were going to begin providing open data and open source projects back into mHealth. And there's a few reasons we do this, and I do a lot of this specifically myself, where we work with a lot of healthcare IT companies, and a lot of it is you spend time reinventing the wheel. And it doesn't matter the size of the company. From a startup with 2 people, I guess people don't work in garages anymore. People probably work in their apartments. 2 people working out of something, all the way to companies up the entire side. You start with a product, and then you start thinking about standards. But there's no reason why it needs to be that way. You can start building a product, or you can start working on products with standards in line. And especially what we'll get to next in situations where hospitals, payers have already been using standards for years upon years. And our goal is to provide developers with a solid starting point for those standards and to build software that supports those standards. And the one thing that I think is really great about mHealth, interoperability wasn't always hip. 10 years ago, especially when I was working at Epic, it was barely a thing. Yeah. But it's as much where I feel like a lot of people are waiting for the silver bullet for interoperability. When we have this thing, it'll be perfect, and everything will communicate data from each other, and we'll all live in harmony until the end of the time. But it doesn't work that way. We're going to get to interoperability by plugging things together, and that's what mHealth does. They build software, it works. And I think that's really cool, and I think it's admirable. And that's a big reason between that collaboration. Catalyze as a whole, we're big fans of open source. You can check it out. We have our GitHub link at the bottom here, but someone was asking questions about HIPAA. Man, would we like to help you out with it. We open sourced our HIPAA policies, the training that we do for modern health tech companies, other documentation and code based upon our audits and experience, and we wrote all of it and we designed it with the modern digital health company in mind. We've built a lot of our software on things like Docker, Mirth Connect, a lot of open source stuff that gives the developers that work with us a lot of flexibility to build things on other platforms as they grow and as they change. And we think that's really important. Most of the employees at Catalyze are programmers. And as programmers, we really like open source stuff. And that kind of plays into all of this as well. Okay, I'm done talking about Catalyze and the partnership. I'm here to talk what everyone actually wants to talk about, EMRs and HL7. Yeah, that's definitely what you came for. So let's talk about HL7 v2. It still makes the healthcare world go round. Registration information, scheduling, notes, transcription information, discrete data is all transmitted through a pipe-delimited format called HL7 v2. There are other newer versions of HL7 v2, HL7, HL7 v3. There's a bunch of other data standards, but most of the way that you transmit a lot of important real-time data in healthcare is through HL7 v2, which was officially released in 1989. If you're looking for another popular benchmark of what happened in 1989, Tim Berners-Lee began to invent the World Wide Web in CERN in Switzerland. But it's been around, and it's stood the test of time, and in 2015, if you want to get data in and out of an EMR system, these are the rules that you're going to need to play by. And it's what, for better or worse, I've dedicated a lot of my life towards working towards. So what we did in collaboration with mHealth is that we started to build mappers to map that HL7 data to mHealth data. So the place that we started was with the HL7 v2 message type, the ORU R01, which in HL7 parlance is an observation. That's okay, it doesn't actually mean anything. The important part is that it has 2 key pieces of data. One, results, so lab results, radiology results, effectively discrete data that you would expect to get out of a lab system from a hospital. And the second thing is discrete data, so the things like heart rate, blood pressure, steps, et cetera. We've built mappers to map that HL7 data cleanly to mHealth schemas and vice versa, and notably extending the mHealth schemas with the help of mHealth to include information in the schema, data from a patient from an EMR, and also information about the encounter which that visit belongs to, since EMRs organize data a bit differently than just timestamps. I can explain more about that further, but I would talk about it for an hour. We can talk about it afterwards. You can grab me outside. The nice thing about mHealth schemas already is that they currently use standards-based standards to identify the information that's in the system. They use SNOMED for a lot of the vitals-based information, and they use LOINC, which are popular standards for lab results. The mappers use that information to map the data from HL7 messages to mHealth schemas and vice versa. And in the GitHub repo, we provided this in multiple forms. The first is just in plain old JavaScript, where we effectively serialize HL7 into arrays. You can check it out if you wanted to build your own software and see kind of how we did it. But if you wanted something that was more plug and play, mHealth Connect is an open source interface engine. It's very popular. It's what we use at Catalyze for all of the integration work that we do. We provide this in an easy plug and play form with open source mHealth Connect, that if you had an HL7 feed coming from an organization, that you could get started parsing that and writing it into mHealth today. Next steps. Again, there's more data types coming out of healthcare systems than just HL7 v2. Working towards support for HL7 v3 type standards and other data, such as HL7 v3 type observations that you would find in a continuity of care document, otherwise known sometimes as the CCDA, otherwise sometimes known as the Blue Button Plus record. FHIR, which is the new hip thing that all the kids are talking about these days, and vendor-specific APIs. And also working towards scaffolding this directly onto the mHealth DSU, so the data storage repository, being able to write that in directly. We've already got it stood up on Catalyze, it's just getting it configured entirely. And then document an explanation explaining our rationale for mapping. So this is all online, and again, as we discussed earlier, everything is entirely open source. If you have any questions, you can submit a pull request or just grab one of us. I'm here with Travis and Kenny here from Catalyze as well, along with the folks from mHealth. I worked with Emerson a lot on this, and we can try and answer any of your questions.